Book 1, Unit 1, Fitness Training, Exercise 5, page 5.
What personal trainers do. Personal trainers lead, instruct, and motivate others to exercise. Personal trainers work with clients. Clients pay trainers to plan a personalized fitness routine for them. Training includes cardiovascular exercise, weightlifting, and stretching. Personal trainers are fitness instructors. They show clients how to perform exercises. Clients also learn how to use exercise equipment. Before the first session, trainers evaluate their clients' needs. This is based on age, weight, body mass, and goals. At this time, the trainer may offer dietary guidelines. A healthy diet makes it easier to meet fitness goals. In most places, personal trainers need certification to work. Qualification standards vary between countries.
Unit 2, The Upper Body, Exercise 5, page 7.
Upper body muscles decoded. Trainers and fitness instructors often refer to specific muscles. These muscles have more confusing names than just hand or wrist. So, we decided to break it down for you. Chest muscles. Pectorals, pecs, are the wide, flat muscles on the front of your chest. Shoulder muscles. Deltoids, delts, are the muscles that go around the shoulders. The rotator cuff is actually a group of muscles inside the shoulder. Back muscles. Trapezius, traps, are shaped like triangles. Latissimus dorsi, lats, are wide, flat muscles on the back. Arm muscles. Both biceps and triceps are above the forearm. Biceps are on the front. Triceps are on the back.
Unit 3, The Lower Body, Exercise 5, page 9.
Squats. When it comes to lower body workouts, you can't beat the squat. The squat uses more muscle groups than most other strength training moves. These include the quadriceps, quads, gluteals, glutes, hamstrings, hip flexors, and calves, muscles. Many people do not use proper form when doing a squat. Here's the correct way to do one. Do not add weights until you perfect the basic squat. Stand with your feet shoulder width apart. Bend at the hips and sit back as if on a chair. Keep your knees over your ankles. Lower until your thighs are parallel to the ground. Your shins and torso should also be parallel. Slowly rise. Repeat.
Unit 4, The Core, Exercise 5, page 11.
The core. The core is a complex set of muscles at the center of the body. These muscles mainly protect the spine, stabilizing the spine while providing support to the back. Strong core muscles do not only improve posture and joints, they also prevent everyday back pains when sitting, standing, or lifting. The core muscles are mainly in the torso. The obliques and hip flexors extend into the pelvis. The rectus abdominis is located at the front of the abdomen. This muscle is visible sometimes as a six-pack. Others, like the transverse abdominis, multifidus, and erector spinae, extend through the entire torso.
Unit 5, Body Types, Exercise 5, page 13.
The 3 common body types. 1. Endomorph. Endomorphs are people with too much body fat. They carry extra weight and have little muscle. They need to exercise and eat healthily to become less heavy. 2. Mesomorph. Mesomorphs are people that are naturally muscular. They weigh a healthy amount for their height. However, they still have to exercise and eat well. Then they will be able to stay lean. 3. Ectomorph. Ectomorphs are people that are very thin. They weigh less than normal. They need to eat more to gain weight. They should also exercise in moderation. Some people's body types do not classify easily. They have a combination of the common body types.
Unit 6, Health Problems. Exercise 5, page 15.
The rise of chronic health problems. Bad lifestyle choices cause chronic diseases. Poor diet, inactivity, smoking, and excessive drinking are examples. Diabetes, for instance, is very common. Type 2 diabetes affects 90 to 95% of Americans with diabetes. Type 2 is not to be confused with type 1 diabetes. Type 2 is caused by obesity, inactivity, and hypertension. Type 1, or juvenile diabetes, is usually genetic. Hypertension may also lead to cardiovascular disease or stroke. Poor nutrition can also weaken bones, leading to osteoporosis. People can reduce their chances of developing a chronic illness. Maintaining a healthy weight is important. Being overweight increases the risk of chronic illness. Proper diet and exercise helps keep BMI to less than 25.
Unit 7, Fitness Goals. Exercise 5, page 17. www.fitnessblogger.com. What do you want to do? It's not enough to say, I want to get in shape. It's great that you want to improve your health. However, to do this, it is important to set goals. State what you want to accomplish. Do you want to increase your muscle strength? Or do you want to lose weight? Maybe you need to rehabilitate a limb to regain movement. Improving appearance is also another popular goal. Exercise plans are not one size fits all. Gaining muscle mass requires different exercise than dropping inches to slim down. Tell your personal trainer your goal, then he or she will build a plan to get you there. Unit 8, Parts of the Gym 1. Exercise 5, page 19.
Galaxy Gym. Who we are. We have 40 health clubs across the country. We're serious about fitness. We're also serious about providing the best services. What we offer. All gyms have locker rooms, saunas, and snack bars. Our weight rooms house 50 machines. Warm up in one of 2 cardio theaters. Our machines offer personalized workouts to fit your needs. Check out our group fitness studios. Sign up for yoga, Pilates, martial arts, or aerobics. Head to the cycling studio for spin classes. Schedules and details are available at our front desks. We address every need with excellence. There are no traditional water fountains here. Instead, we offer water coolers. Restrooms are located within the locker rooms.
Unit 9, Parts of the Gym 2. Exercise 5, page 21.
Ballard Fitness. Fitness for every season. Buy 3 months. Get 3 months free. Purchase a membership for $300 plus tax. We'll include a $20 certificate for our snack bar. At Ballard Fitness Center, we know what you need. Are you feeling stressed out? Relax in our sauna, steam room, or hot tubs. Do you enjoy competitive sports? We offer full basketball courts, racquetball courts, and tennis courts. Take a swim in our Olympic-sized pool, or take a jog around our indoor track. Don't hesitate to bring the kids along. Our childcare center is well supervised and offers fun activities. Call today to take advantage of this limited time offer. 713-782-9348.
Unit 10, Exercise Equipment 1, Exercise 5, page 23.
Muscle Fit Machines. Welcome to Muscle Fit. We are the online source for commercial-grade fitness equipment. We carry the top brands at reasonable prices. Free weights. Our free weight package includes 2 weight benches and 2 barbells. It comes with a set of dumbbells weighing from 5 to 75 pounds. In addition, you receive 2 kettlebells, 14 pounds and 18 pounds. Buy now and get a set of spring collars for free. $2,699.99. Weight machines. We offer every kind of weight machine. We sell machines with stacks and weight pins or with plates. Shipping is free. Call for pricing. Special offer. Spend more than $300 on hand weights and get 3 sets of ankle weights for free.
Unit 12, Exercise Equipment 3, Exercise 5, page 27.
Yvonne Corelli, Certifications, Certified Personal Trainer, Certified Aerobics Instructor, Certified Suspension Strap Instructor. I usually start sessions on the mats. This gets the muscles stretched out and ready to work. Foam rollers are incorporated in the warm-up. Then I play a game of catch with clients using medicine balls. Sometimes I add in the balance trainer to up the level of difficulty. Jump ropes get the heart rate up. Stability balls, fitness bars, and resistance bands are my favorites for strength training. I also teach a group fitness step aerobics class twice a week. I utilize stepping blocks in my classes.
Unit 10, Exercise Equipment 1, Exercise 5, page 23.
Muscle Fit Machines. Welcome to Muscle Fit. We are the online source for commercial-grade fitness equipment. We carry the top brands at reasonable prices. Free weights. Our free weight package includes 2 weight benches and 2 barbells. It comes with a set of dumbbells weighing from 5 to 75 pounds. In addition, you receive 2 kettlebells, 14 pounds and 18 pounds. Buy now and get a set of spring collars for free. $2,699.99. Weight machines. We offer every kind of weight machine. We sell machines with stacks and weight pins or with plates. Shipping is free. Call for pricing. Special offer. Spend more than $300 on hand weights and get 3 sets of ankle weights for free.
Unit 13, Actions 1, Exercise 5, page 29. Workout Plan Week 1, Monday, Warm-up, jog or walk 1 mile on the treadmill. Chest, push-ups, place 2 medicine balls on the floor. Lean your weight against them. Lower your body to the floor, bending your elbows. Push your body back up by straightening your arms. Triceps, pull-ups, place your hands on an elevated bar. Pull yourself up until your chin is above the bar. Tuesday, warm-up, jump rope with 50 repetitions. Arms, lift 10-pound weights. Abs, lie flat on your back on the floor, place 1 arm under your head. Reach to your knee with your elbow, twisting your torso. Do 50 repetitions. Turn and do the other side. Wednesday, cardiovascular training, run for 3 miles. Unit 14, Actions 2, Exercise 5, page 31.
Kettlebell exercises. Two-handed swing. Stand with knees shoulder width apart and slightly bent. Swing the kettlebell between your knees. Thruster. Hold the kettlebell with one hand. Squat down. As you come up, raise the kettlebell by stretching your arm upward. Lower your arm back down to the starting position. Lunging press. Holding a kettlebell in one hand, lunge forward. Stand up and raise the kettlebell over your head. Lower it back down. Windmills. Stand with feet shoulder width apart. Raise the kettlebell overhead. Rotate your body at the waist. Reach down and touch your toe with your free hand. Be careful not to release the kettlebell during the exercises.
Unit 15, Career Options. Exercise 5, page 33.
Trainers choose from a variety of work settings. In the past, jobs for trainers were limited. However, the field has grown rapidly. Now trainers have more opportunities. They can choose from a variety of work settings. Guests at resorts and spas often use trainers. Trainers can also work on cruise ships. They help guests get in shape during their free time. Some corporations also hire trainers. These businesses have fitness training facilities on site. Trainers work with the corporation's employees. Trainers can work for universities as well. There, they help students get in shape. Finally, trainers can also do in-home visits. This allows clients to get independent training.
Book 2, Unit 1, The Muscular System. Exercise 5, page 5.
The muscular system. When we train, we build muscle tissue. Muscles are attached to bones by tendons. Bones are joined together by ligaments. Without bones, joints, and muscles, we would be unable to move. That is why it is important to take good care of your muscles. The muscular system contains 3 different muscle types. Skeletal muscle. These muscles are connected to the skeleton and operate in pairs. We have the power to control these muscles. Therefore, they are voluntary muscles. Smooth muscle. This kind of muscle is located in the body's internal organs. We cannot control these muscles, so they are involuntary. Smooth muscle is able to keep tension for large amounts of time. The digestive system, blood vessels, and the bladder are examples of smooth muscle. Cardiac muscle. This heart muscle is involuntary and makes brief single contractions. These twitches are made possible because cardiac muscle can stretch and contract.
Unit 2, The Cardiorespiratory System. Exercise 5, page 7.
Chapter 2, Unit 1, The Cardiorespiratory System. A properly functioning cardiorespiratory system is crucial to a healthy body. It is composed of the respiratory and the cardiovascular systems. The respiratory system involves the nose, mouth, and lungs. Humans take in oxygen during inhalation. The lungs then add oxygen to the blood. They also remove carbon dioxide. Then, the carbon dioxide is released via exhalation. The cardiovascular system centers around the heart. It transports oxygen-rich blood to body tissues. It also removes waste produced by the body. If the cardiorespiratory system is functioning properly, a person will have normal breathing. If people are exercising or exerting themselves, they might begin to breathe heavily. This is not a problem. Heavy breathing can also be caused by a malfunctioning cardiorespiratory system. This signals a person has deoxygenated blood. The body reacts by taking rapid, erratic breaths in an attempt to get sufficient oxygen. Sometimes this is a result of conditions like asthma or anxiety.
Unit 3, Biomechanics 1, Anatomic Locations. Exercise 5, page 9.
Anatomic location, superior. Examples: the thigh is superior to the shin. Anatomic location, inferior. Examples: the heel is inferior to the knee. Anatomic location, proximal. Examples: the wrist is more proximal to the elbow than the knee. Anatomic location, distal. Examples: the knee is more distal to the elbow than the wrist. Anatomic location, anterior. Examples: the biceps are located on the anterior portion of the upper arms. Anatomic location, posterior. Examples: the hamstrings are located on the posterior portion of the thigh. Anatomic location, medial. Examples: the inner thigh muscles are located on the medial side of the thigh. Anatomic location, lateral. Examples: the ears are located on the lateral side of the head. Anatomic location, contralateral. Examples: the right hand is contralateral to the left foot. Anatomic location, ipsilateral. Examples: the left foot is ipsilateral to the left hand. There are also 3 planes that divide the body into sections. They are the sagittal plane, the frontal plane, and the transverse plane. The planes are positioned at right angles, so they intersect the body at the center.
Unit 4, Biomechanics 2, Muscle Actions. Exercise 5, page 11.
Muscle actions. There are 3 types of muscle actions. They include isotonic, isometric, and isokinetic movements. Isotonic contractions develop force and tension through a series of movements. They include eccentric and concentric phases. An activity such as walking on a treadmill produces eccentric movement. In this instance, there is a length-tension relationship. The muscle lengthens and reduces its force. A concentric action occurs when lifting weights. Here, the muscle shortens and increases its force. Isometric and isokinetic actions are quite different from each other. Isometric contractions create a stabilizing force and no visible movement. On the other hand, isokinetic contractions create fixed movements. Isometric actions occur during sports training or when performing everyday activities. Yet, isokinetic actions require expensive and sophisticated equipment. Movement is constant and tension is at its maximum. For example, exercises involving rotary motion lead to a force couple. This produces torque in the muscles and bones.
Unit 5, The Fitness Assessment. Exercise 5, page 13.
Personal Trainers Quarterly. Fitness Assessments by Dr. Frederick Gambino. Volume 14, page 90. Good trainers need to understand their clients' fitness levels. For this, you must conduct a fitness assessment. The first step of the assessment is a health screening. This determines if your client can be physically active. Be sure to include a medical history questionnaire. Remember, never provide medical advice to clients. Direct them to a doctor if needed. First, complete the health screening. Then, begin the physical assessment. You should measure the client's heart rate, blood pressure, and body composition. You have several options for determining body composition. Perhaps the easiest is to take skin fold measurements. You must take these at 4 places. 2 are arm measurements. The other 2 are the subscapular measurement and the iliac crest measurement. You can also take circumference measurements. These do not provide information about body composition. They are sometimes useful, though. Specifically, they help you calculate the client's waist-to-hips ratio.
Unit 6, The Workout. Exercise 5, page 15.
Fitness Trainer Magazine. Designing a Great Workout by Julie Dresden. Workouts should contain variety and be creative, but they all include several important components. You should always begin with a warm-up. Never skip this. Make sure to include stretching. It helps your client get ready to work harder. It also can prevent injuries. On that same note, always end with a cool-down. Stopping activity abruptly puts strain on the heart. A cool-down helps the heart gradually return to rest. It doesn't decrease muscle soreness, though. That's a common misconception. All workouts should include aerobic and anaerobic exercise. Aerobic exercise can be anything from running to cycling. Weightlifting, resistance training, and push-ups are all examples of anaerobic activities. Good trainers can sometimes design their routines to combine the two. Always closely monitor your clients for signs of boredom. If they are tired of a routine, change it. Recommend a fun group fitness class to keep them motivated. And remind them that conditioning takes time and hard work.
Unit 7, Phases of Training. Exercise 5, page 17.
The optimal performance training method. All of the trainers at our gym are certified in optimal performance training methods. This scientific-based training plan is designed for real people. Our lives tend to be sedentary, and we are often deconditioned. Let us help you reach your goals effectively and safely. Before beginning the program, your trainer will give you an assessment. After that, you can start the first phase. 1. Stabilization endurance training. This phase addresses muscle imbalances. It focuses on stability, endurance, flexibility, coordination, and neuromuscular efficiency. 2. Strength endurance training. This phase includes hybrid training techniques. It promotes stability, endurance, and hypertrophy. It uses supersets, one exercise followed quickly by a second. 3. Hypertrophy training. During this phase, expect many repetitions with only short rest periods. 4. Maximal strength training. This phase focuses on improving body strength. 5. Power training. This phase uses force and speed to maximize your power. Expect supersets.
Unit 8, Flexibility Training. Exercise 5, page 19.
Flexibility training. Flexibility training is crucial to being in the best shape possible. There are several different kinds of stretching. Each works in a unique way to increase your range of motion, ROM. Static stretching involves holding a stretch while breathing deeply. This will gradually increase the extensibility of the limb being stretched. Passive stretching is a type of static stretching. It entails holding one limb in place with another. Isometric stretching involves tensing the muscles while extended. This increases the overall tension during stretching, thus yielding greater mobility after. PNF stretching is a combination of passive and isometric stretching. Active stretching is when a limb is held in an extended position with only the muscles in that limb. Dynamic stretching is the use of movement to stretch. The swinging of limbs allows them to loosen. Ballistic stretching entails the use of jerky movements to force limbs to the limits of their ROM.
Unit 9, Cardiorespiratory Training 1. Exercise 5, page 21.
Cardiorespiratory training. All personal trainers need to know the FITTE principle. All personal trainers need to know the FIT principle. Frequency is the primary factor. Ideally, all clients will exercise every day of the week. New clients should exercise at low intensity levels for 30 minutes. As they become more fit, trainers increase the level of intensity. They also increase the training time. The type of training depends on a client's needs. For example, some clients want to focus on cardiorespiratory fitness. Trainers design fitness plans to meet that goal. Exercises may include jogging, running, or swimming. Enjoyment is the final factor. A client is less likely to quit when having fun. When working with less fit elderly clients, engage in light exercise. Healthy younger adults require moderate exercise. These activities should be monitored and increase the heart and respiratory rate. Activities should not be hard. Perform a talk test. This ensures that clients are working at an adequate intensity. Clients breathe heavily when at their maximal exertion level. When this occurs, decrease the intensity level.
Unit 10. Cardiorespiratory Training 2. Exercise 5, page 23.
Cardiorespiratory fitness, stage training. Trainers conduct cardiorespiratory training according to the principle of specificity. The goal of fitness training is to increase the workload. As clients adapt, chances of injury or overtraining decrease. Clients become stronger. They are also able to maintain a low rate of exertion. There are 3 training zones with increasing levels of exertion. Exertion is measured by heart rate. Clients need to maintain a zone 1 heart rate for 30 minutes. After reaching this level of fitness, they begin interval training. Intensity levels vary between intervals, with differences in speed and incline. Trainers may alternate exercises during fitness training. For time efficiency, clients often prefer circuit training. This method consists of strength training and cardio exercises. It is as beneficial as interval training. However, it includes minimal rest periods. All stage training programs ought to include recovery days between workouts. Recovery time minimizes the risk of chronic fatigue. It also helps clients regain energy and avoid drastic weight loss.
Unit 11. Balance Training. Exercise 5, page 25.
Client, Rafaela Martinez. Visit number 4. Notes. Rafaela needs to continue to work on her balance. Her stationary balance has improved significantly. However, her dynamic balance is not nearly where it should be. Further balance training will lower her risk of joint dysfunction and other injuries. Plan for future balance training. 1. She should continue to do balance stabilization exercises. They should be made more difficult by changing variables. For example, she could balance on one foot or on more difficult surfaces. 2. She should begin to do some balance strength exercises. These include squats and lunges. During these exercises, she should focus on maintaining her center of gravity above her feet. This will help her to avoid becoming unstable. 3. Lastly, she should attempt some balance power exercises. They primarily include hopping followed by stabilization. These will challenge her to regain a stable position after moving. By practicing decelerating, her ability to maintain equilibrium will improve as a whole.
Unit 12. Plyometric Training. Exercise 5, page 27.
Using plyometric training with clients. Plyometric training is coming back. It isn't just for athletes anymore. Clients with average fitness levels include explosive movements in their workouts. With my clients, I've noticed rapid progression. I've also noticed greater use of potential energy. They are able to project themselves from ground surfaces quickly. Exercises such as jumping onto boxes are most helpful. Allow me to explain how these exercises generate force. I'll use the example of jumping onto a box. During the loading phase, the body prepares for the jump. We lower our bodies to the ground. We reach the transition phase when we are prepared to jump. During the unloading phase, we thrust ourselves upward. The exercise establishes a movement pattern within our bodies. Muscular force slows down, stabilizes, and speeds up. According to the integrated performance paradigm, muscles require this pattern. It creates effective movement. With repetition, clients notice improvement in their overall training. They become faster, stronger, and less prone to injury.
Unit 13, Speed, Agility, and Quickness Training. Exercise 5, page 29.
Ballard Fitness Club offers. Ballard Fitness Club offers SAC training. Improve your speed, agility, and quickness. Classes are open to all. What are the benefits of SAC training? SAC training improves the body's ability to accelerate and decelerate. Studies show that it improves muscular strength and coordination. It also improves the nervous system's reaction to a stimulus. What do you do during SAC training? We usually perform ladder agility drills and T-drills. These exercises help improve form and athletic performance. The training may be difficult at first. However, over time, stride length and stride rate improve. Clients move quickly while maintaining their center of gravity. Clients will exercise for 90 minutes per class. How much do SAC training sessions cost? We offer 2 sessions per week. That means there will be 8 per month. Enrollment for 1 month costs $30 for gym members. For non-members, it is $60 for 1 month. For more information, please contact Rob Simons at rsimons78@ballardfitness.org, or you may call at 915-787-0980.
Unit 14, Resistance Training 1, Exercise 5, page 31.
Unit 1, Resistance Training. Resistance training is the use of weights to strengthen the muscles. It can cause a series of bodily reactions. 1. First, the body experiences an alarm reaction. Delayed onset muscle soreness is common during this stage. 2. Resistance development is the body's increased ability to cope with the resistance training. 3. Finally, the body can also experience exhaustion. Fortunately, this bodily breakdown or injury can be avoided by using periodization. The SAID principle should be followed to determine how many repetitions and sets different people should do. It has 3 different components. 1. According to mechanical specificity, less weight and a greater number of reps will improve muscular endurance. Greater weight and fewer reps build maximal strength. 2. Neuromuscular specificity pertains to the style and speed at which weights should be lifted. 3. Finally, metabolic specificity is important because it involves the amount of energy used by the body for different exercises.
Unit 15, Resistance Training 2, Exercise 5, page 33.
Resistance training systems. Single set system. 1 set is performed for each exercise. Multiple set system. Unlike the single set system, multiple sets are done for each exercise. Pyramid system. The load is increased or decreased during each set. During the light to heavy approach, the load is increased as reps decrease. For the heavy to light variation, reps increase as the load lightens. Superset system. 2 exercises are performed in direct succession of one another. drop set. Drop sets are performed until failure, and then continued with less weight. Circuit training system. Multiple sets are done with minimal rest in between. Peripheral heart action system. This workout is a variation of the circuit training system that alternates between upper and lower body exercises. Split routine system. Different parts of the body are trained on different days. Vertical loading. Exercises are performed in succession down the body. Horizontal loading. Unlike vertical loading, horizontal loading entails completing every set for a specific exercise or body part before moving on to the next.
Book 3, Unit 1, Nutrition, Exercise 5, page 5.
Here are some diet guidelines to improve your nutrition. A guide to better nutrition. 1. Eat 5 servings of raw fruits and vegetables each day. Vegetable juice is also satisfactory in that it provides nutrients. However, it does not contain the healthy fiber found in whole vegetables. 2. Avoid refined sugars. These include some sweeteners, candy, and non-diet sodas. These foods are simple carbohydrates which alter insulin levels. 3. Eat 3 servings of whole grains, nuts, or beans each day. These foods contain complex carbohydrates which create energy. 4. Fats should be consumed in moderate amounts, no more than 20 grams per day. Some fats are better for you than others. Excessive intake of saturated fat and trans fat can result in heart disease and obesity. However, monosaturated and polyunsaturated fats can help improve heart health and lower cholesterol levels. 5. Eat a handful of nuts or seeds each day. Pumpkin seeds are especially beneficial. They contain good fatty acids and are a source of protein. People living an active lifestyle should consume 2,000 calories per day. Physical activity increases total energy expenditure. Maintain this calorie intake to avoid declines in your resting metabolic rate. Also, thermic energy expenditure accounts for 6 to 10% of total energy expenditure. So, make sure your meals and snacks are beneficial.
Unit 2, Supplements, Exercise 5, page 7.
Supplements. Our bodies need many nutrients in order to stay healthy. Sometimes it can be challenging to get these nutrients through our diets. That is where dietary supplements come in. Supplements can be in the form of pills, capsules, powders, and liquids, but they all serve a similar purpose. They add vitamins, minerals, herbs, or amino acids to the body. We only need these nutrients in small quantities. Therefore, it is a good idea to check out a nutrient's dietary reference intake. This tells us how much we should be consuming. In some cases, it also lists what amounts of a nutrient are dangerous. Just as a deficiency can be harmful, excessive ingestion can be toxic. Multivitamins are the most common supplements that people take. However, sometimes multivitamins contain more than the upper limit of nutrients. Referring back to the recommended intake can help you choose the right multivitamin for you. Ergogenic aids are another type of supplement that people take. These are different because they improve athletic ability rather than health. Athletes sometimes also take stimulants for their ergogenic impact. Please note that these aids may sometimes be illegal. Supplements are not regulated like medicines, so do your research in order to select a legal, safe, and effective supplement.
Unit 3, Age Considerations, Exercise 5, page 9.
Great Fitness Gym. Great Fitness Gym offers specialized training for youth and senior adults. Our fitness trainers understand the physiologic differences that occur as people age. Therefore, our programs are both safe and effective for clients at any age. When designing programs for adolescents, we take into account individuals' growth, development, and physical maturation. Just because two youths are the same age does not mean they have the same capabilities. We offer sports training for young athletes. We also offer general healthy lifestyle physical fitness training. Our youth training programs focus on aerobic, muscle strengthening, and bone strengthening exercises. They promote fitness and confidence in participants. Training sessions for seniors are designed to help them prolong functional independence. Aging results in degenerative physiologic functioning. Muscles become weaker, cardiorespiratory fitness declines, and bones become brittle. Regular exercise has been shown to slow the onset of such problems. Our trainers take considerations such as prescribed medications or chronic illnesses into account when designing plans for seniors. With both age groups, our trainers adjust how vigorous training sessions are based on client capability. Hydration is promoted throughout training sessions. Trainers allow for frequent water breaks to ensure clients replace the water that is lost from sweat. In addition to personal training, the gym offers several youth and senior group fitness classes.
Unit 4, Training and Chronic Conditions 1, Exercise 5, page 11.
Fitness Training Journal, Volume 16, Number 5. Training and Psychological Considerations for Obese Clients. Obesity is the fastest-growing health problem in all industrialized countries. The rise in morbidly obese individuals is a particular concern. Working with a trainer can help these individuals develop a healthy energy balance. It can also dramatically improve their self-esteem. A sedentary lifestyle leads to loss of muscle mass and increased body fat. Regular physical activity is the key to physical and mental well-being. Obese clients must be assessed for general health before beginning an exercise program. Body measurements including BMI, scale weight, and circumference are recommended. Develop a program that clients can adhere to. Emphasize low energy expenditure at the start. Exercises will increase in intensity over time as tolerated. This should include proprioceptive training and weight-supported exercise. Walking is a good exercise to include in any program. Focus on improving the client's gait. Clients will enjoy increased mobility over time. Remember that there are psychosocial factors associated with obesity. It is important to earn a client's trust by respecting his or her privacy. Develop a training program gradually. Increase the intensity as appropriate. Clients will be delighted with the physical and psychological results.
Unit 5, Training and Chronic Conditions 2, Exercise 5, page 13.
Exercises for diabetes and hypertension. Trainers must be especially cautious when working with clients suffering from chronic conditions. Of particular concern are diabetic and hypertensive clients. Diabetes and exercise. Exercise is an effective means of treating both type 1 and type 2 diabetes. Be aware of specific exercise guidelines to prevent hyperglycemic and hypoglycemic events. Many clients with type 2 diabetes are obese. When recommending a physical exercise program, be careful about microtrauma. These can develop into severe infections. Special care should be taken to maintain stable blood sugar levels. Caution clients about carbohydrate intake post-exercise. Hypertension and exercise. Exercise can have a modest impact on lowering blood pressure. Strenuous exercise is inappropriate for both hypertensive and hypotensive clients. Trainers should evaluate clients' heart rates in response to exercise. Body position should be monitored during the training as well. Supine or prone positions can increase blood pressure. They should be avoided. Resistance training should be performed in a seated or standing position. Ensure that hypertensive clients breathe normally. Avoid the Valsalva maneuver and a tendency to overgrip equipment. Confirm that clients with chronic conditions are under the care of a physician. Advise continued use of prescribed medication.
Unit 6, Training in Chronic Conditions 3, Exercise 5, page 15.
Client Information Sheet. Cardiac Rehabilitation Program. Name, Sandra Jackson. Home phone, 234-555-1400. Date of birth, 11/14/60. Fitness health goals. The client would like to focus on weight loss and overall health. She wants to improve cardiac health, muscle mass, and joint health. Current fitness activity level, low to moderate. Injuries restrictions. The client had a fall last year. She fractured her right radius. She still suffers from arm pain and limited mobility. Recommendation: a strengthening program to improve use and avoid further deterioration or disability. Do you have a history of coronary heart disease? Yes, no. If yes, please specify personal history and/or family history. Yes, personal and family history. Client's father and brother have also been diagnosed with coronary heart disease. Do you have a history of arthritis? Yes, no. If yes, please specify osteoarthritis or rheumatoid arthritis. Yes, client has osteoarthritis with occasional flare-ups. The arthritis particularly affects her knee and wrist joints. Additional risk factors to be considered. The client is at risk for osteopenia. She has had some loss of bone mineral density. Recommendation: weight-bearing exercise to build strength. Begin with short walks to limit muscle strain and bone stress. Physician's consent form on file. Yes, no. Yes.
Unit 7, Training in Chronic Conditions 4, Exercise 5, page 17.
Care for clients with cancer or lung disease. Take special care when developing treatment plans for clients with chronic illnesses. Cancer and lung disease, in particular, can lead to diminished bodily functions. Studies have shown that a carefully managed exercise program can improve quality of life. Well-managed medical intervention and therapeutic exercise mediate some adverse effects of these illnesses. Cancer patients should be evaluated to determine their overall health and ability levels. Exercise programs should be developed with caution. Clients should remain under a physician's care. Chronic lung disease is divided into two major categories: restrictive lung disease and obstructive lung disease. Restrictive lung disease is characterized by dysfunctional fibrous lung tissue and restricted airflow. This is generally caused by the inability to fully expand the lungs. With obstructive lung disease, lung tissue is generally normal. Airflow is restricted by airway obstruction, caused by mucus production. Chronic obstructive lung diseases, such as bronchitis and emphysema, are often caused by smoking. Encourage clients to begin a smoking cessation program. Asthma is also classified as a chronic obstructive lung disease. Asthma symptoms, particularly in children, may be caused by environmental factors. Clients with lung disease should be monitored for low energy levels and dyspnea.
Unit 8, Safety, Exercise 5, page 19.
When working with clients, it is important to ensure their safety. Accidents can result in clients suing the gym and the trainer they were working with. Some trainers have clients sign waivers stating the trainer is not liable for any injuries that occur. However, waivers are not always foolproof protection. The best thing you can do to protect you and your clients is provide a safe training environment. Constant supervision is crucial. Do not let distractions take your attention away from your client during training. Make sure they are performing exercises and operating equipment properly. Survey the equipment on the premises to make sure it is in good condition. If it is not, report it to the gym manager so maintenance can be done. Do not let clients use equipment that is in need of repair. Commercial fitness equipment is designed to be used by many people. Do not use home fitness equipment to train clients in premises such as a gym or health club. Do not try to push clients past their capabilities. This can result in clients injuring themselves. There is no way to completely prevent accidents and injuries. However, you can reduce the risk by providing clients with proper supervision and a safe environment.
Unit 9, Injuries, Exercise 5, page 21.
We all know that exercising is good for your health. However, care must be taken that it is done properly, or else injury can result. These injuries may be minor, such as a bruise or a blister. Other common injuries are pulled muscles and sprains. These things usually repair themselves in a few days. Shin splints are painful. They aren't an injury themselves, but a symptom of an injury. Shin splints are caused by inflammation of tendons or stress fractures in the lower leg. Tennis elbow is also caused by overuse. The overuse causes tears in the tendons or muscles around the elbow. Both tennis elbow and shin splints can usually be treated with ice and rest. Tendinitis is another overuse injury that may be treated similarly. More serious injuries require medical attention from a doctor. Many people think of carpal tunnel syndrome as something office workers get from typing on a computer all day. It can result from playing some sports as well. A splint may be needed, and in some cases, injections or surgery. A dislocation needs to be reset into place by a doctor and immobilized. Deep lacerations may require sutures. The best prevention for injuries is paying attention to what you're doing. Inattention is the #1 cause of accidents.
Unit 10, CPR and First Aid, Exercise 5, page 23.
Personal trainers. Personal trainers should be certified in CPR and first aid. Some employers require a CPR AED certification. This allows them to give immediate treatment to clients who experience heart attacks or trauma while working out. In some cases, knowledge of CPR and first aid can be the difference between life and death. All gyms should be equipped with a portable defibrillator and a first aid kit. The first aid kit needs to contain some basic items such as bandages, gauze, and antibiotic ointment. More comprehensive kits may contain latex gloves, analgesics, cold packs, and syringes. Trainers also need to be familiar with the signs of shock and how to treat it until emergency responders arrive. Shock occurs when the body does not get enough blood flow. Shock can result from blood loss, head injuries, dehydration, severe trauma, and heart failure. Even after a primary injury is treated, shock can still kill someone. In the case of heart attacks, major trauma, and shock, emergency help should be summoned immediately. Trainers should memorize the phone number for local emergency responders. When possible, have one person call while another begins administering CPR or first aid.
Unit 11, Social Influences, Exercise 5, page 25.
The importance of social influences. If people have a strong social support network, they are more likely to continue exercising. Friends and family can offer emotional support such as encouragement and praise. They may also offer instrumental support. This includes offering to babysit children while a person works out or providing transportation to the gym. Informational support is available through the trainers and exercise leaders at the gym. Another positive influence is companionship support. This is when a friend or spouse works out with someone to keep him or her motivated. However, not everyone has these kinds of support networks. When this is the case, a person should talk to a trainer about finding support. Trainers may be able to offer suggestions about groups in the community or even online groups. Some gyms also have special programs designed for specific groups such as women or senior citizens. These programs offer the opportunity to develop connections. There is often an orientation where people can get to know each other. Even with strong support, people may still have trouble sticking with a regular exercise routine. The most common barriers are a lack of time and unrealistic goals. In some cases, social physique anxiety can also be a cause. Talking to a trainer may help people overcome these obstacles.
Unit 12, Coaching and Behavioral Strategies. Exercise 5, page 27.
Chapter 2, Coaching and Behavioral Strategies. Coaching plays an important role in the trainer-client relationship. However, trainers should also help clients develop self-management skills. Good coaching and self-management skills increase the chances of a client's adherence to a fitness program. Solid self-management skills can help them in other aspects of their lives as well. One self-management skill is goal setting. This should include both short-term and long-term goals. What does the client want to accomplish within the next 2 weeks? The next month? What does the client want to accomplish in a year from now? Encourage clients to set timely, specific, and measurable goals. Also, goals should be attainable. If goals are not realistic, clients can become discouraged when they don't reach them. Another self-management skill is self-monitoring. Clients can see where they are doing well or what they need to improve. Also, promote self-talk. Clients might look at you funny when you tell them you want them to talk to themselves. However, positive self-talk may help get clients psyched up for the task at hand. Stress that negativity in self-talk is not acceptable. Exercise imagery is also another tool to help clients succeed at reaching their fitness goals.
Unit 13, Getting Started. Exercise 5, page 29.
Planet Gym. Pilates, aerobics, personal training. Get fit easily, starting today.
Question. I have just received my personal trainer certification. Now what do I do?
Answer. First of all, congratulations. Your personal training education from an accredited program is complete. Now you're ready to look for employment. Community facilities such as parks and recreation centers or commercial fitness clubs offer good opportunities. You can get in-house, hands-on training in these settings while drawing a paycheck. Keep in mind that many fitness club revenues depend on membership fees and purchased services. You may be expected to use marketing in order to get gym members to sign up for your training services. Another option is being an independent contractor. In this case, you contract with a fitness facility to use their premises while training clients. This usually involves paying the facility a set fee or a portion of the income you make from training sessions. As an independent contractor, you do not get any employee benefits. You have to use marketing to sell your services. You have to set a price for your services and utilize distribution channels to reach potential clients. You also have to be proficient in customer service, time management, and organization. However, these are business skills that can help you open your own facility in the future.
Unit 14, Building a Client Base. Exercise 5, page 31.
Build your client base. Katrina Scott, personal trainer to professional athletes and movie stars, can help you build your client base. She'll tell you the best self-promotion techniques to reach potential clients. Some of the things she will discuss are greeting people and introducing yourself, coming up with a memorable opening line. How to be proactive, roaming the facility, assisting potential clients, etc. Creating explanations and demonstrations to show potential clients the value of working with you. Why overeducating potential clients will put them off. Katrina's seminars have helped numerous personal trainers expand their client bases. Here's how her seminar has benefited trainers just like you.
Katrina's seminar is amazing. By following her advice, I have doubled the number of clients I have. M. Lewis, Fairmont Heights, Vermont.
Katrina's seminar gave me the tips I needed to promote myself and begin interactions with potential clients. I tell all my fellow trainers they have to take this seminar. P. Edmondson, Los Angeles, California.
The seminar is being held at the City Library on 7th Street on May the 13th at 7 p.m. Admission is $10 per person, and seating is limited to 100 guests.
Unit 15, Running a Business, Exercise 5, page 33.
Business tips for personal trainers. Whether you have your own premises or partner with a gym, running a personal training business takes effort. The first thing you need to do is draw up liability waivers for clients to sign. You also need to get insurance to cover you, your equipment, and your facility if you have one. Next, you need to let the public know about your services. Place advertisements in the local newspaper. Some stores also have bulletin boards where you can hang flyers. One of the best ways is through word of mouth. To facilitate this, you offer current clients a discount for every new client they refer. Another way is to build a reciprocal relationship with other health and fitness professionals. For example, ask a yoga instructor to keep your business cards at his or her studio. He or she can hand them out to clients looking for a personal trainer. In return, you would recommend the yoga instructor to your clients. See what other trainers in your area are charging for sessions, and then set a comparable rate for your services. Always be punctual and professional when dealing with clients. Having a good reputation will help ensure your success.
AVN Pharma Education.